CellsToSell.
Yeah!
Hey everyone, welcome back to CellsToSell. My name is Him, that's Nick, and today we have Graciela Carrillo with us,
hi, guys.
otherwise known as Gracie.
Thanks
right?
for having me.
Yeah, for sure.
Thanks for coming on. We
Yeah.
appreciate you coming on. Oh,
So-
it seems like, so what, this is now 3 weeks in a row we've had
RGME
second year RGME females on.
Yeah.
Kind of a trend. But
Yeah, you
it's
guys are
cool
on a
because,
roll.
again, everybody that comes on here has a different background, different stories. So
Mhm.
we're interested to hear that. We wanted the people to know that, like, you know, we're not just all, you know, necessarily like biochem majors who like we're on this path. Like we all kind of like stumbled upon this a little bit in some weird but lovely way. So
Yeah.
why don't you tell us a little bit about yourself, where you're from, like where you went to like high school, college,
High
what you
school?
studied. Yeah,
Wow.
like all the way back.
Okay, well, I'm from Brownsville, Texas. It's a small town near the border of Mexico. I grew up with parents that, immigrated to the United States, and they encouraged me to go to college and all that, right? So I went to, talking about high school, I went to Med-High, which is just students wanting to have a career in health professionals, so like doctors, pharmacists, all that.
So it's a high school straight?
It's a high school
for like
Yeah,
pre-health?
yeah.
No
so,
way.
So I don't know if Debbie talked about it, but we had all these people that wanted to do something to do like more like doctors, more like nurses,
yeah.
pharmacists. And then you had another school that was med tech, which I went to that one first and then I transferred. But that one's more like technicians, right?
Mm-hmm.
Then I went to UTRGV and I majored in Biomedical Sciences. I guess like the reason why I chose science was more of like geared to like what I wanted to do in the future, which was like medicine.
Mm-hmm.
I wanted to be a doctor. I was looking for that. I took all these like requirements that you need to enter medical school or apply for it. From there, I just I graduated, and then I was like, what do I do? I'm studying for the MCAT, but while I'm studying, what can I do? So I took a job as a medical scribe. I did it for 3 years.
Which department?
Wow.
ProScribe. Yeah, that's their companies.
Yeah.
Okay.
Right?
Yeah, but like which
like
which
scribe
part of the
America.
hospital? Like ER?
Oh,
Like,
okay.
Where
So
did you scribe?
I started in the ER.
Mm-hmm.
And then I moved to, which is in the hospital, and then I moved to the clinics. So I was ER, clinic, and then I did virtual because of COVID.
Oh yeah.
And then, I stayed virtual for a little while. I liked it better, to be honest,
Yeah.
than going in person. But then it gets complicated with tech stuff. So,
Oh yeah.
so then afterwards, I was. It kind of got like not boring, but I wanted something else.
Mm.
I didn't want to stay medical scribe forever. And so I decided I wanted to go to a master's. I wanted to like move on with my education.
Yeah.
So Debbie was telling me all about like the master's program, and part of it was because she was also going just to have someone there with you.
For sure.
But also the program, what it was like promoting,
For
that you
sure.
would be like a laboratory technician or a research assistant or be in the industry with companies.
For sure.
I was like, oh, this sounds good.
Mm-hmm.
So I went for it. I applied, and here I am.
Nice.
Yeah.
That's pretty cool.
Yeah, that's really
Yeah.
cool. I have more questions about your high school.
High
And,
school,
like,
yeah,
how,
go ahead.
Was it a private school?
Oh no, it wasn't private school. It's one of those like magnet schools, I want to say.
That's so cool.
I don't know. I've never
I've
heard
Oh, you don't
of
know
that.
magnet
high
schools?
school, dude.
Well, I guess it's like the Valley area, because it wasn't only like that, because it's okay. So I'm from Brownsville, right? And it's like the school that I went to is like an hour away, so I had to go and through a bus. So
Every
it was
day?
like every day an hour.
Oh my god.
So I woke up like super early, right? But in my hometown, they also had magnet schools. So it wasn't just medicine, it was engineering, it was, I want to say it was like environmental or agriculture. And then,
Finance?
yeah,
Did they have
finance
finance?
probably, yeah, they
Yeah.
probably did.
So did you have to test into these schools?
Yeah.
Like, I'm
No.
confused. Like,
No.
anyone can enroll to these
Anyone, yeah, you just if you want to enroll to one that was specifically geared to what you wanted to do or your interest, then you are more than welcome to like.
Imagine picking a specialized high school at 14 years old.
Yeah.
Like,
Oh,
Mom,
really?
I want to be a
Seriously.
doctor. Send me to the med.
It's like, do you like? What do you want to be when you grow up? You want to be an astronaut? Okay, then go
Then
to
go to the
engineering
engineering
school. Yeah,
school.
But it's like,
yeah.
you know, in college you get that more specificness.
Right.
In college,
in
of
high school
course,
we
yeah.
did like a bunch of stuff, you know, because
Of
like
course.
at least I wouldn't have known
No.
at 14, 15, 16 to
No.
do that
I
stuff.
loved reading
Yeah.
Great Expectations my senior year of high school. That was awesome. I've learned so much from that book.
But yeah, that's what I chose. I mean, of course, I wanted to do med high, so I transferred. So I had like a transferring of like from like 9th grade to 10th grade because med tech was a different environment than med high.
So, okay, so you didn't have to pay tuition.
I mean, I guess not. Like taxes. What is
Yeah,
don't
sure.
taxes pay for?
So like
that?
when I went to like a private, like I went to a private Catholic high school,
Oh.
like I had to pay like X amount of dollars to go
Yeah.
there a year. Like was that
Yeah.
kind of how that magnet school was?
Okay, so no, that I think the magnet schools were public. They were with
Wow.
the what is it?
Or the state?
ISD programs. I don't know. I don't know if every state has like a
Kentucky doesn't have that at all.
no, like I don't even know what ISD stands for, but it was like BISD, and that is they took charge of like the whole area.
You know how
Okay.
AP has the other, there's like people can take AP
Dual
classes.
credit?
IB. Is it IB?
IB?
IB is like these IB exams you take. You take like these advanced placement.
Oh.
And IB sometimes have entire like schools.
Oh, you're talking like Ivy League?
IB. Like
Oh.
not IB. Not IB.
No.
Oh, okay.
I don't
Okay,
think it's
whatever.
that.
Okay, hold on, another question. Did these
Yeah.
schools have sports teams?
The ones that were not the one. Well, no, not the one that I went to. The ones that were more like my hometown. Yes,
Okay.
so they have their
I was just
sports.
wondering
Yeah.
how much of a high school environment it really was. And then finally, the last question before we get into your master's program
Right.
is, did you feel like that med tech or that med high
Prepared me.
prepared you for undergrad? Like, did you go in feeling like you were like, oh, like Gen Bio, that's a breeze. I could probably
Oh, I
test
guess
out of
so,
that.
that's
Like,
true.
you know what I mean?
I mean, I think I was a smart kid when I was in med high. So I don't know. I feel like everyone had like a different perspective. And some people were like, it's just high school. Let's just go through with it. And then some people were, I don't know. They were really like focusing already on the MCAT.
Yeah.
Yeah.
Wow.
And I thought of it.
In high school.
In
Yeah,
high school?
and I thought of it
Yo!
like, no, I
Psychic.
let me see what's gonna happen. So there's 3 routes that you can take. I want to say there's 3. If not for sure, there's 2. So there's the pharmacy tech that you can do, or you can do kind of like med tech, nursing rotations. So I did pharmacy tech instead because I wanted to, at the end have a job after high school and take the certificate for pharmacy tech, which I did take it.
Without going to, you didn't want to go to college?
No, I did.
Oh,
I
you
did
did.
like while being in college.
Like,
You-
work as a
it-
certified farm tech.
Yes, exactly. Which I did take it, but there was no positions in my town to like.
Mm-hmm.
Did you
Yeah.
do the retail or the hospital?
Oh, it
Test.
was. What do you mean, the pharmacy tech?
Yeah,
The test you said?
yeah. Which one did you take?
I don't know.
I think they're the same, actually.
I thought there was.
Which
just...
one would you want to? I worked in retail pharmacy. And
Oh, retail. I did retail.
it was horrible.
Oh yeah, I know. I did CVS,
I did Kroger, and it was
Kroger.
horrible. Anyways.
Yeah.
Anyways.
It gets busy, right?
So it gets so busy.
yeah.
Excuse me. Oh. So, what are you doing?
I don't know, there's something, but.
We're still recording.
Okay.
So,
Okay.
high school to
UT or GV?
Undergrad.
Yeah.
where was your undergrad in a big city? Because right before the college you mentioned
Oh.
Cleveland was a big city for you, so
Yeah, it was. It was in my hometown.
it was in your hometown.
Yeah, literally, like I live like really close to the border. Like you have no idea. Like people would like cross over like the Rio Grande Valley River, which is what separates my hometown to the next town, which is Mexico. So people would just cross the river, and you could see them sometimes. Like they would like cross over to the neighbor's backyard, and they'll be there like instantly. Like there's some houses that are so close that people can like just be in your backyard
Wow.
like that easily.
That's
That's
crazy.
an insane
Yeah.
experience.
But so this school is also really close to Mexico.
Mm-hmm.
So it was like a 5-minute drive for me. The program was, because I did a program, Biomedical Science. It wasn't really like pre-med normal route tradition.
Right.
So we had like our curriculum was more of like it was based off 8 weeks. Every 8 weeks we had like a different kind of like topic.
Kind of like med school.
I guess,
Wow.
yeah.
Med school is like 8-week rotations.
Yes,
You learn one
yes,
thing for 8
there were
weeks, and then you take a
rotations.
test at the end of like another week, and then you get like a couple days off, and then you go back for another 8 weeks.
Yes, that's what it is. It was rotations, but it was with different professors, different classes. So,
Now, did you get any exposure to stem cells, gene therapy?
Stem
what
cells?
you're into now, like.
I did not know they existed.
Really?
Well, okay. Not that I did not know they existed, but I did know about the bone marrow transplants, right?
For sure.
I did know because I did this. What's this? Not a program, a club. Sorry.
Mm-hmm.
The club did this volunteer opportunity where you would help out Be the Match program.
So you're talking like
you would
like
help
for
them.
blood donors.
Yeah, you would
Yeah.
help that company recruit people
Oh,
within the
okay.
university.
Wow.
So Be the Match, right? They were looking for bone marrow donors.
Mm-hmm.
So that's all I knew about, I guess, regeneration or something.
Mhm.
Yeah, I mean, I hadn't heard of regeneration in medicine in like ever
Right?
until the MS like email came up. So yeah, how did you find RGME? Did you
Other-
get the email too?
I did
or
get the email. No, I did get the email. And then I guess Debbie also got it around the same time I did,
Mhm.
and we were just talking, and she just said that she applied, and she was like, "You should look into it." So that's basically what happened.
Yeah.
Yeah.
So now, like, so Gracie's a second year, and
Yes.
she's gone through, good amount of education about this field.
Yeah.
So in regenerative medicine, what do you find like the coolest, and like what do you want to get involved in for your
coolest?
career?
Are you talking specifically like a therapy type or?
Sure,
Just in
therapy
general,
type,
yeah.
science. Like we know we took nanomedicine together. That was
Oh, the
a cool
nanomedicine.
class,
Yeah, I did like the nanomedicine class. It was cool. I think. Well, I like more of like the type of, I guess, how to use the stem cells to like not completely have an alternative new drug, but you can use it with something else
Yeah.
and
Okay.
pairing it to enhance the drug.
Like combinational therapy.
Yeah, I feel like we're not there yet with the stem cells because they keep failing where it's just like
Yeah.
completely just the drug.
Mhm.
Like it should be paired with like the first line of therapy.
Mm-hmm.
So I also was interested in like type 2 diabetes because type 2 diabetes runs like a lot in the Hispanic
Yes.
population.
Yeah.
So finding like a different alternative, but in a way of using the drug to like metformin to
Mhm.
enhance what it already does.
Ooh.
That'd be
Like
interesting.
I don't know, like regenerating the pancreas or
Yeah.
something.
The beta
So-
islet.
Yeah.
Of the
Right.
pancreas.
Yeah. So I'm obviously thinking on the science of whoever's watching. I don't
No,
know.
it's okay.
No,
I'm
it's
like
fine.
wrong.
No.
But I'm pretty sure. I think with regeneration of the pancreas, that could be like a new route.
For sure. it is,
Right?
Yeah.
Yeah, absolutely.
So yeah. So I think also like how you said nano that class, we were taught on like nanoparticles. So I think like doing something with nanoparticles too is cool.
Definitely.
Yeah.
I mean, our vaccines, they are lipid nanoparticles.
Yeah.
That like
Yeah.
So it's like this technology exists, but like in the
Yeah.
context that we learned, it was very cool, especially like the long-term drug delivery.
Oh yeah. The long term would be really nice for type 2 diabetes because they need like the glucose for long term.
For
They
sure.
and especially if let's say the nanoparticle is like engineered in a way that it's triggered to just deliver glucose on its own without the patient, injecting themselves repeatedly.
I know, right?
Yeah.
Yeah.
Yeah, that's wild. I think, so we talked a lot about the science. What do you think, like the regenerative medicine part's interesting, but like, were you intrigued by this program by any part of the entrepreneurship side?
Like the entrepreneurship
Yeah.
side? I don't know if GMP, like knowing how it's manufactured, is qualifying as the entrepreneurship, but
Not really.
Not
It's
really,
like
right?
in between science and industry. It's like
Right, that's like
how
the- that's the-
science
that's
gets
the
to
stepping stone.
that's the
Yeah,
steps.
that's the stepping
Well,
stone.
that one, I mean, that part of the, I guess, the GMP, right? Manufacturing was something that was interesting too, because you don't know how that goes from how it translates, right? That's the word. So I guess from the entrepreneurship side, I would say, I mean, right now with this class, I mean, I'm learning new things that I didn't know. Cleveland is a big spot for regenerative medicine now.
You know, we go to the National Center of Regenerative Medicine. Case is the National Center of Regenerative Medicine, which is crazy to think about.
And I think in 2003, Dr. Gerson was responsible for starting it here.
Oh,
so he filed a bunch of stuff and was like, Case does all this stuff, so we should host the National Center. But now there's also issues with that being in Cleveland. And
why? What happened?
I think
Midwest is dry.
Funding is a little,
unfortunately.
Yeah. But I feel like, okay, yes, there's no funding here, but couldn't they, they don't have to leave Cleveland, but they can, travel, yes, and talk to investors outside of Cleveland and then come back and reestablish or continue with what they're doing.
That's true.
I'm not sure if that's more difficult or for the investor wise, right?
It's just you go to San Francisco, or you go to Boston, where all these VCs are, these venture capitalists are with all this money, and it's the networks that they have are all intertwined with Boston or San Francisco or LA, Silicon Valley, whatever you're doing. And I think that just moving there just makes it so much easier to collaborate rather than jumping on a Zoom call or whatever.
I get you.
I don't know.
In person is better.
But I think Cleveland's growing. Has to be.
So the CEO of one of the consulting firms here in Cleveland called Regenerative, she worked at Pfizer for 10 years in their commercialization department. So when she's running her new company, she's using the experience she got from a bigger company. So when we think about getting investors and advisors and mentors from Cleveland area, the experience they have isn't as that raw being in California. They just have so much experience about how things have gone and failed that they can look at you and be to avoid any failure, go in this direction. Whereas for us, we're kind of try it all, you will fail, keep going,
Right.
It's not avoiding, it's helping us and telling us. So that's the one thing I feel could be better.
Yeah, I mean we're talking we only have really pre-seed money. But we don't have any, we barely have pre-seed to seed stage money. We don't even have, there might be one Series A investor here, but how much money can they really throw around? They can't. So I know people watching this aren't in our class, but we read it I can't remember, is it Brian something
for today?
For today, Brian, is it Brian
We
Byrne?
looked up this picture.
Is it Brian Byrne?
Yeah.
So Brian Byrne developed
Wave or Phenom?
It's Phenom.
Phenom.
And it eventually combined with Wave Sports plus Phenom. And it's it's a sports entertainment thing, right?
Right.
And he wrote an article. This is the point. You read the article that we had to read for class, but the article was basically him slandering Cleveland and Cleveland investors for not being able to keep Cleveland startups, and they have to move because there's no more money.
Yeah.
And I see where he's coming from. It was really harsh. It was a really, really harsh article, but he's kind of got a point that he's experienced it firsthand where he's trying to raise money and these guys are taking, or girls, whoever the VCs are, but they're taking a really long time to get deals through and go through negotiations. He's they're killing startups instead of nurturing them. He's we just have to leave because there's so much more money and people just move so much faster.
Especially if it's heavy
Tech.
Digital.
Yeah.
I get that Cleveland Clinic Ventures is here, but they wouldn't have taken Wave plus Entertainment.
No.
It's way out of their industry or focus, right?
Exactly.
So it's more diversified in San Francisco.
Yeah.
So.
And even New York for healthcare is not, it's
right.
New York is a financial district.
Oh,
absolutely.
Yeah.
There's so much finance going on.
Yeah, banking,
all the Goldman Sachs, all of them are there.
Right.
All of them are there. But Boston is their industry is pretty much biotech.
Yeah.
I don't know how much finance and other stuff is there. Miami, because of the laws, I think is a little bit better too.
Yeah. So do you think because all these like you said, New York is finance, Boston's biotech, and I guess California is tech, wouldn't they benefit from like helping each other and like maybe like spreading their people around? I don't know.
They could, but I think that would be a lot of resources and
Yeah.
a lot of money. And I think that's why they're not doing it.
You,
But, like,
money wise, it's like too
Oh, I
expensive.
think so. I
Yeah.
think so. And like, I don't know, like the startup space is so interesting because it changes so much. Like in class, we learned about how high it was in 2020, 2021. Like
Yeah.
2022 started kind of creeping down, and then 2023 first quarter crash.
Uh-huh.
Like, go on. And like, I think that people just kind of like sticking like to their own is kind of how people are like staying right now. And networking, collaborating is good, but I don't know if we're going to be able to like share resources. I think that would take away some of the competition. I think. So
I mean, regardless of the business side of things, I think the science is still pretty cool here.
absolutely.
Yeah.
So do we want to talk about what you're doing in the lab?
Oh, what I'm doing? Well, my internship was mainly nanomedicine or nanoparticles, and my project was related to diabetic retinopathy, and I guess most of it's complicated from type 2, type 1 to type 2 diabetes.
Mm-hmm.
So basically, we're just trying to investigate a new way of delivering the current treatment for it, which is anti-VEGF, which is a factor, like anti-vascular growth factor.
Yeah.
So using nanoparticles instead of like a virus, which is like adenovirus,
Right.
to deliver it.
I was gonna say, don't
Mhm.
they use a lot of like AAVs,
Yes.
adeno-associated viruses to like
Yes,
with like
which-
the eye to
right.
like genetic stuff?
Right, which is like not that safe, or they just need more like repeated injections into the eye.
Right.
So this new, I guess, alternative would be safer and would be long term,
Gotcha.
right? So what our aim for this first part of the project was to engineer the DNA with the nanoparticle and then transfect it into like the cells.
That's super cool.
Like right into the eye.
No. We had a plate of cells to mimic, I guess, the eye, right?
Yeah.
So we had like retinal epithelium cells that we would like culture, passage,
Yeah.
and when they were ready, you would transfect them with the DNA PI, and then you tag them with GFP so that when they, if they did transfect, you would see the green fluorescence.
That's super cool.
Yeah.
Nice.
That's super cool.
So then I did another project on the side, which is just comparing silicone with cyclodextrin nanoparticles,
Yeah.
and it was just a drug release protocol that we were doing.
Cyclodextrin's cool. It looks like a tube, right?
I didn't see the tubing. I just saw it like in a form of actually it looks like silicone.
Really?
Yeah,
No
I
way.
think she formed it in a way like it would look like a silicone, but it just has like a more capabilities of releasing drugs.
Over long term.
Yeah.
That's super
It's
cool.
cool
Yeah.
stuff.
Yeah. So that's my project.
Are you comfortable using mice? Have you ever used mice?
I have not used
Dude,
mice.
same.
I do want to try it just to
Yeah.
see how it feels. So
They're mean.
they're mean.
He does so much mouse work. I feel like I feel bad, but he's desensitized.
I haven't done a lot of mouse work lately.
No.
But you have, right?
But I have
In the
like
past few months.
injecting
Okay.
like 40 mice a day with like drugs.
And you work with who in the lab?
Amartisai.
I've heard of who did he?
He came in
our
he came in
class.
first
He came
year.
for like the
Oh.
apheresis.
Samita was with him,
Samita
right?
did it.
Oh, okay. So then, what do you do with the mice, or why are you killing them?
Well, we do like there's a bunch of reasons we kill them.
Okay.
And let's say sack them.
Sacrifice. Okay.
Oh, you
what's
sacked
sacrifice?
him? Oh my
We
god, is
sacked
that
him.
what sack means?
Yeah.
Oh, why?
I thought sack was like in football, like you sack. You
No.
sack the quarterback.
Oh no, I didn't.
No.
No, you don't sack.
No, there's a bunch of reasons we sack. So like today we just had like we had a 25 mouse harvest
25.
where we took out we took off both legs, flushed bone marrow, took out spleen,
Yeah.
crushed up spleen, and then another. And she's actually a MD PhD student. And this is she's studying like epilepsy and stuff. She's super cool. She was taking out the brains.
Okay.
Yeah, and like there were 6 of us in the lab today. We were cutting in, flushing, staining, getting ready, and like we ran. We started at like I think 10. I didn't get there till 11:30. By the time I
Okay.
got there, most of the mice were done. But I think Brittany, as we record this now at 3:51, is probably done running over 100 flow samples.
Whoa.
Yeah, so we did that in like 4 hours,
4 hours.
4 or 5 hours. And like that's like probably the biggest harvest I've seen is 25. But
Yeah.
so we work in the I work in the comprehensive cancer center with Dr. Desai.
Yeah.
But we're more of like, I would argue that we're more of like, at least the practice I'm on, we're like a drug development lab. So like he does a lot of like the 15 PGDH, and like, you know, how it affects hematopoiesis and like all that kind of stuff.
Right.
We work in collaboration with a couple other labs on campus, specifically the Adams lab, their drug development lab. I'm pretty sure Dr. Adams has like a background in like organic and medicinal chemistry, and it's like super cool because I get to work with a MD PhD from there.
Right.
So I actually helped him run his last couple replicates for his Nature paper. So I'm like a 4th, 5th author on a Nature paper, which is super cool.
That's crazy.
That's crazy.
But like I can show you on the paper. I literally just helped with the 6th figure, like just the
really?
6th figure. Yeah. But like my flow
fun.
cytometry is on there.
Yeah.
That's actually really awesome.
Well, probably Dr. Desai like touched it up a little bit, but yeah, like the flow on there is like what I ran.
That's
yeah,
awesome.
super cool, right?
Yeah.
That is really cool.
So,
Oh, nice.
but like I did like basically all the mouse work for that last
Yeah.
two replicates to get them enough data.
Oh, okay.
But like we do like aging projects and we do injections and survival. We do a little bit of cell culture. We do a ton of PCR. We do everything. Anything that comes across the size table, crosses mind, we're doing.
Really?
Yeah. Yeah.
Is he like a fun guy?
He's great.
Yeah.
He's great. He's like,
I heard they have their own snack table.
yeah,
What the heck?
he's
does that
super
mean?
into his work.
Snacks.
He's like super into his work, and
Yeah.
he pushes us really hard. But
Yeah.
that's because his lab pushes out really good data,
Yeah.
and it wouldn't be good if he didn't push his employees hard. So
Yeah. Do you think that like have you gotten like more like technique
Oh my
experience,
God,
like lab
yeah.
technique experiences?
Oh yeah, absolutely,
Yeah.
absolutely. Back when I first started, it would take me like 3 hours to start from like having a full mouse, dead mouse,
Yeah.
and taking off its legs and taking out the spleen and staining it for flow.
Yeah.
Now I can do that in probably an hour. Now I can probably do it in, let's say, an hour and 30 minutes.
And
Getting all the cells out,
Yeah.
and staining, and then being ready to run flow cytometry. Yeah.
And have you ever like killed or sacrificed some mice before?
Yeah.
Really?
Yeah.
Okay.
All the time.
Okay. I
When
was
there's
just
a-
What, in
wondering.
undergrad?
No, not an undergrad here though.
No, I was talking about like before here.
No, I'd only
Like
seen it. I'd only
Yeah.
seen it, and we do it a different way here than how I saw it.
Oh, okay.
I saw it like my cell biology teacher would take a mouse by the tail, like use its claws, like get to the top of the
Right.
cage, and you just take like a scalpel and just like really fast, like cut its neck.
Nice.
And like it's super fast.
Yeah.
The way we do it here is much more
Humane.
barbaric. No,
Oh,
not.
you think
Well,
it's
there's
barbaric?
2 different ways you can do it. You can either
Yeah.
use your hands, which is what I do. It's a lot faster.
What do you mean?
No.
No.
You can use your hands, or
Uh-huh.
you can use a CO2 chamber, which takes like 15 minutes. You can only load like 10
Doesn't CO2
5%.
chamber literally like destroy their insides too though?
Well, like they fall
Wouldn't
asleep. They fall asleep, and then there's no oxygen, so they just like
But
calmly
their
sleep.
cells, don't the cells like die quickly?
No, they're
No.
fine as long as you extract them within a certain amount of time.
Mm-hmm.
They're
Yeah.
still alive and good.
But can you show it? Like how do you kill it with your hands or no?
I mean, you can look it up. It's called
Ah.
cervical dislocation.
I can look it right now. You can show it. But
I don't have a mouse.
This is the mouse.
I don't have a
This
mouse.
is the head. This is the head.
It's
of the
okay.
mouse.
Literally, what I do is I'll take them by the tail.
Yes, like that. Show it to me like
I'll
that.
take them
yeah.
by the tail.
Uh-huh.
I'll take them by like the neck, pull them
Uh-huh.
back. I'll put them like on the bench. I have like we use pee pads, which is I think is hilarious, like puppy pads.
Oh, yeah.
So like we don't like the
Yeah.
glue pads, so we don't make messes.
Right.
And all I do is like take them by the neck, and like I'll pinch my fingers and push down forward,
Oh.
and I'll dislocate. I'll basically cut their
You-
spine off.
Do you feel like the click?
Oh, it pops. Yeah.
Yeah.
And they don't just like die immediately. Like their tongues pop out, like not like all the way out, but like their tongues go out, and like they like kind of jump, like they jump around, like we have jumpers. So I'll just set them down, like they'll start jumping across the table for like a minute, and then they'll relax after their
Wow.
rigor mortis stops.
I've seen
That's-
ketamine overdose, which usually kills them but keeps their heart pumping,
Yeah.
so the blood still goes everywhere. And I've also seen another kind of overdose where they put them in like a closed thing, and they like first they'll like spray a bunch of chemicals on there, put the mouse in there and close it. So
Isn't
then
that the chamber? That
they
you-
suffocate. It's
Like
not
gas
CO2
chamber?
though. It's not CO2. It's like
Oh.
literally some sort of chemical. Some really,
Oh.
like
That's
maybe
so
cyanide.
bizarre.
Like for us humans, like
Yeah.
if we're in a room of cyanide, like we're gonna die.
Right.
Like gaseous cyanide, but like for them, it's like they were inhaling these chemicals.
I
and
never
they just
thought
died.
on this podcast I'd describe how I sack mice.
Eventually, I
it's
thought it'd
curious.
come.
I thought it was interesting.
I mean,
I've
like,
never seen it,
well,
so-
but so like the deal is though, is if you like, you usually have to like, if you do CO2, you have to do cervical dislocation anyways. So we just
Oh,
do
okay.
So Gracie, what do you want to do for your career?
What do I want to do?
If somebody listening to this podcast is trying to recruit somebody, what would you want to tell them? Like, what do you want to do?
What do I want? Well, okay. I am very like, to be honest, I'm ready for anything.
Yeah.
Like, I would probably do the research assistant, but not with anything, of course, but like something that's interesting with regenerative medicine.
right.
Yeah.
And I've looked at immunology, oncology, all of those interest me. And so, I mean, if anybody's looking, I'm ready.
So
And-
if you were part of a startup,
Yeah.
you could do
Yeah.
regulatory compliance, you could do
Yeah.
lab tech stuff, you could go raise money,
Yeah.
you can do anything, is what you're
Exactly.
saying.
That's what I'm saying. Exactly. Yeah. And apart from like entrepreneurship, I mean, there's the FDA class that they were
Mhm.
promoting here at Case.
Mhm.
I'm taking that class right now, and it's
How
like,
is it?
It's very interesting. So right now, I just finished a midterm,
Mhm.
and it was you choosing a technology. So I chose not. It had to do with serorefractory GVHD, which comes after you get like a hematopoietic transplantation, like let's say
Mhm.
bone marrow,
Mhm.
and you get.
Is that just chronic GVHD?
No, it's acute GVHD.
Is it acute? Okay.
Yeah, it's still acute. And they were using MSCs MSCs with steroids still to treat the patients, and so they won't be like rejecting
Wait,
the
so they
treatment.
got HSCs,
Super cool.
and then to reduce the GVHD, they used MSCs
To reduce.
and steroid
Okay,
combination.
so they got the transplant, like the main transplant that they needed to like cure their disease, right?
Sure.
Then afterwards, some patients got GVHD, which is the rejection of the main transplant.
Yeah.
And then some patients out of that group also got steroid-refractory, which is basically the steroid did not work to cure the GVHD. So what they thought was using MSCs
Oh,
with
geez.
with steroids or immunosuppressant agents to further, maybe like they needed a boost or something, because MSCs are known to be also immunosuppressive.
For sure.
And so that was the whole technology. So we had to write a paper of
Wow.
like the investigator and the FDA perspective.
Interesting.
Yeah.
So that's interesting. I actually have a few questions then from that. It's just like,
Oh, yeah.
if somebody did fine with the original transplant, but somebody did not,
Uh-huh.
do you have to first give them a steroid after for the people who failed? And then the protocol says if they fail that too, then they can get MSCs. Or can they get MSCs right away?
I mean, I don't know the answer to that question, but I want to say they would get the MSCs right
Like,
away.
right away, right?
Yeah, I mean, are you saying like instead of like going through all those?
Why make
Yeah.
them fail? Why make
Yeah,
them fail?
at the end of that paper, I was like, why are they adding more stuff to the patients when they're like they can just go straight to the MSCs?
Mhm.
They just want to test if it works, and if it failed at the end of the day.
Oh,
So,
did it?
Yeah,
Oh my God.
it didn't pass phase 3. So interesting. It worked in pediatric patients,
Mhm.
and I did not read that paper fully, so I don't know why pediatric patients were more like accepting, I guess, the MSCs with the steroid, and that drug for those patients has been approved. So I'm interested to know what's there.
For sure.
Yeah.
Maybe it has to do with something for like the naive kind of not fully developed immune system.
Right,
That might
could be,
interesting.
yeah.
That would be a really cool paper to read.
Yeah. So.
You know, in India,
Mhm.
like they have CAR T stuff very, very recently.
Yeah.
And just because the sheer number of people there and because their laws aren't like FDA, there's no
Regulated.
like FDA there, right?
Right.
Okay, CAR Ts are given as first or second line of treatment nowadays.
Yeah.
Like for anyone who has any sort of like symptoms for a disease,
Yeah.
they'll first inject them with CAR Ts
That's insane.
first instead of trying the other medications that are
Yeah.
historically.
And how do
like
they?
horrible.
Okay, I might be wrong. I don't know. But
Yeah,
how
yeah.
do they get the CAR T cells first?
There's a
from-
huge banking system in India. Like, there's not a issue.
There's
with
no issue with
donations.
donations, engineering the CAR T, and then
The only issue is like contamination
yeah,
and a lot of like
risk.
Adverse effects. and
adverse
risk,
effects.
yeah.
Like you can get a
Yeah.
lot of autoimmune diseases from CAR T stuff. Is
Yeah.
apparently a thing.
Yeah.
50% of CAR Ts have like crazy autoimmune diseases after.
Yeah.
So I don't know. It's interesting to see where this industry will go.
And have you seen success, or like have they been?
I'm sure.
Yeah.
I'm sure there's some success stories and some fail stories.
Yeah.
But it goes to show you that concept. We learned about it in our program, the
Mhm.
medical tourism.
Yeah.
Oh yeah, it's there.
Yeah, for
Yeah.
sure. I mean, like, if I had somebody sick, and it's like there's nothing in U.S., why would I not go elsewhere, right?
Exactly. Yeah.
So-
I mean, yeah, these patients are probably looking for like the last line of treatment. Like,
Mhm.
what else can they do?
I feel like if you're applying to be part of a clinical trial, it's like pretty dire. Not
Yeah.
gonna lie.
All right.
The first young girl who received CAR T cell therapy for the first time, she was like weeks away. And the CAR,
Oh.
like now she's like 10, 15 years cancer free.
Really?
Wow.
Yeah, super cool, right?
Yeah.
Is it multiple myeloma girl?
Yeah, I think so.
Okay.
Yeah, multiple myeloma, like she was like 8 or 9 or 10,
Yeah.
and like last line, boom,
Yeah.
it worked. And how crazy is that? It was like phase 1. That was like phase 1. Like this is the first time we're really trying to see the efficacy.
Yeah.
And by God, it worked. So.
I think that's what keeps us going, right?
Oh,
Like-
absolutely.
Like to do our find something interesting.
What's crazy is like CAR Ts literally changed the shape of the science we're studying. Like if CAR Ts didn't work, no, I don't know really how many people would be like, oh, cell therapy.
Oh, I see.
Right?
Yeah.
Like it'd probably be more like gene therapy focused, but like now it's a combination of like, okay, let's put these genes in the cells, and these cells can really do some crazy things. But
It's true.
I
CAR
love
Ts
that, yeah.
have been around since like what, 2011?
Something recent.
Yeah, like not too long, but like
Yeah.
think about all the advances we've made already.
Oh yeah, for sure. I think CAR Ts when we found out about it was like interesting. It was like a new concept too.
Mm-hmm.
Yeah.
Dr. Wald here.
He's great.
I'm
Oh,
taking
yeah.
immunology, and we actually had a class yesterday
Mhm.
about transplantation.
Yeah.
And the professor mentioned like Dr. Wald here is doing really awesome work because like I think everybody knows him as a CAR T guy because like
He is a
Oh,
CAR T guy.
yeah,
he
he
works
does
on my
some-
floor.
he does pretty cool stuff.
I'm gonna ask him if he has availability to work on something there.
Probably.
Sure, I mean
Yeah.
always
Yeah.
people are looking
Yeah.
because even in our class, Cleveland Clinic Innovations, they're like our GME program is very good for what we're trying to start growing.
Yeah.
But I
Right.
feel like us RGME students, we gotta be a little patient. I know, but I think
Yeah.
this
Come
industry is
on.
also a little, you know.
I know. So then I guess do you guys have backups to
Lab tech,
lab
like
tech?
really just to
Yeah.
take up the time and also like
And have you clinical trial coordinators or something like that?
maybe
Something.
sure if there was a position, I feel like I would be down.
Yeah.
I think I'll end up working in a startup somewhere, whether it's my own or someone else's.
Yeah.
Eventually, I'll be in a startup,
Okay. yeah.
consulting, and I think one thing I've said this in this podcast before. Excuse me.
Mhm.
One thing that I think is super cool
Mhm.
that a lot of us have going through our GME and that people don't is there are business people and there are science people.
Mhm.
Right.
Business and science people do not meet very well in the
No.
middle. They
Okay.
butt heads all the time because the business people don't understand the science and the science
Yeah.
people don't understand the business.
Yeah.
Right?
Yeah. Basically.
We're gonna be able to go into a company,
Mhm.
say like a biotech company, and look at the CEO in the face and say, they're gonna start hey, you're gonna shadow the lab technicians for this week and learn the process.
Yeah.
You're gonna be like, I already read your papers, I already know your results, I already get it.
Mhm.
I'll see the process, I'll see what they're doing,
Mhm.
but I already get it, and these are the 5 bullet points that I came up with that I think that we can improve on
Yeah.
as a business to improve both the lab and the business because I understand both sides and I can talk to both sides,
Yeah.
right? We can sit in class and we can after class talk to the people who come, the entrepreneurs who come in and talk to us, say hey, this is what we're doing, this is really cool. They're
Mhm.
that sounds awesome. Keep doing what you're doing. But then with the people who come in to talk like Dr. Walt or like people from like Aviona or Forge. Like I talked to the lady who came and talked about Forge, talked to her for like 10 minutes after class. And I could sit there and talk to her about cell culture, AAVs, all that kind of stuff, bioreactors, how like what types of
We do have a good foundation.
So like, we have a great
Yeah.
foundation to be like that hybrid of like, we understand the science, we can develop science, but we can also develop business. And that's
Right.
something that I think a lot of people don't have. That's why this Case Western is like 1 in 1,000 in the country. Right? There's only one of these really. I don't think there's too many other things that are focused on science and business.
And if
there's
they
really
are,
not.
it's like in California where it's like
Right.
more expensive.
Exactly.
to
So
get.
like, this is such a cool program, and I know that this program by all means is not perfect.
Yeah.
All the students have talked about it. I have my gripes with it. I know you second years have your gripes with it.
Yeah.
Like I know it.
Second years.
I know you do. You older people. So I don't know. I feel like I'm very lucky to be here, and it's such a cool position. And it's still sucks because I can talk to my parents and they still don't know what I'm talking about. But that's totally okay.
At least you can like say the words.
Right.
I can't even say
Oh.
You can't say regenerative.
All I know is células madres.
Your parents don't speak any English?
No, they don't. None of them
Wow.
English.
Wait,
No.
how did you learn?
How did I learn English?
Yeah, just.
Oh, so I didn't learn English until middle school, late
You're
middle school.
kidding.
Yeah.
Oh my god.
Yeah.
Well, I mean, so like teachers like speak Spanish, like
All through elementary was Spanish. They would teach us Spanish. I took the state test in Spanish.
Wow.
Yeah. The reading
Super
section
cool.
was easy, so I mean, yeah. I like in middle school I went to a private Catholic school, and that's where I got the English. Yeah.
Wow.
Cool. Wow.
Wow.
I would have never been able.
Yeah.
No, I don't have the accent.
Not at all.
I don't even know if I ever had it.
Yeah.
So
Wow.
yeah.
All right. Well.
Yeah.
Yeah. Good episode.
Good.
Yeah.
Okay.
Great.
Thank you for coming
Thanks
on.
for
Thank
coming
you.
on.
Super awesome story. And
Yeah.
Oh,
good
thank
luck
you.
with everything.
Yeah. Thank you
And
for
I
having
think you'll be
me.
seen on this channel pretty soon again.
I know. Yeah.
So,
I'll
all
be
right.
coming.
Well, we want to thank you guys for watching another episode of CellsToSell. If you made it this far, can't thank you enough. Remember, we should say this at the beginning: like, subscribe. You just help us grow. We want to bring this to as many people as possible. I know Gracie's going to share it on everything, and everybody's going to watch it from back home. So thank you for watching. Thank you for learning. And yeah, you got anything else?
That's all.
All right. Well, this has been another episode of CellsToSell. I'm Nick, that team, and that's Gracie. See you guys next time.
See you.